It's like combining the CAM or complementary and alternative medicine modalities with conventional cancer treatments. Now the question arises, why is it very much important when conventional treatment is going to take care of this cancer tumor or cancer burden or tumor burden, something like that. So imagine there is a mall and there are around 500 people inside, some shopping and the personnel of the mall as well. And suddenly that is attacked with some terrorist. Now what will happen? They will take everyone in a hostage, and afterwards some commandos will come. There will be some uh, firing work going on there, bullets and everything. And finally, the commandos will eliminate all these terrorists. But in this operation, all this operation, what will happen is some of the hostages might get killed because of bullets from either commandos or the terrorists, or somebody will get injured also. There will be lots of damage of the mall at the same time. So now all these things are also very much necessary to be taken care of. Just killing the terrorist is only half work done, sort of. Exactly, the CAM approaches are taking care of all this collateral damage, especially. Again, there should be some remedies that this sort of attack should not happen in future. So for that also we need to take a lot of measures like implementing more CCTV cameras or deploying some more security personnel or taking some more escape ways so that the people can escape in such type of calamities. So all these things are also equally necessary and all these things are being taken care by CAM modalities. Now, this we all know these are all the conventional treatments, and these are like the commandos now who are killing the all the terrorists who have already attacked our mall. But the collateral damage that has to be taken care of is done by the complementary system. And here at LYBL, we provide you this type of integrative module for cancer care. Now, this is inspired from ancient Ayurveda and yoga, which are the indigenous sciences. Ayurveda is like herbal supplements in the form of, and also some dietary and lifestyle advices. So these herbal supplements, what will they do? Is they will balance Tridosha and promote health. Now, what is this Tridosha? We are going to see it later. Again, nutrition and lifestyle is equally important. Like the diet should be nutritious and it should be good for your digestive fire at the same time. And there can be some small irregularities in the lifestyle. Those also need to be corrected. And again, therapeutic yoga, which will enhance the mental health and the emotional well-being at the same time. So this is like a tripod and we are trying to give the support to the life of the patient with this tripod. Now how this our LYBL healthcare works? What happens is it will provide evidence-based care plan. This is very much important. Uh, Anyway, all the protocols have been inspired from Ayurveda, but at the same time they are evidence-based also. Either the complete formulation or the majority of the ingredients, they are research based and they are proven as useful in a conventional research modalities as well. So there are what happens, as Dr. Baswati ji already has mentioned, the cancer journey is very much long and there are we have divided it into different stations which will be needed to be taken care of. We will come to that afterwards. Again, another thing is this, many times what happens is traditional systems uh, generally or sometimes they might lack data. So ours are data based and we will try to create some new data for future as well. And it will also provide the safety profile of all the ancient medicines. Whatever formulations have been created are literally totally safe. Now, the journey about which Dr. Baswati talked about is the 7 stages we have identified. So, even though the patient is the same and the cancer is the same, but depending upon what stage of treatment the patient is, needs of the patient are totally different, and we try to offer our support or holistic support to address those type of problems. Now, it's a newly diagnosed cancer. What does it literally mean? That's recently the cancer is diagnosed, but yet no conventional treatments have been started yet. It can be a short time window of maybe 15 days or 1 month as such. In this time window, the principal need of the patient is like taking special care of the psychological shock, because this diagnosis itself is a big psychological blow and patient might be under anxiety or depression. We need to take care of that. So addressing the psychological stress, and there can be some symptoms also. We try to manage those or help the patient to work on these symptoms with our formulations and complete care plan. And in enhancing the mental resilience, so to cultivate the positive mindset and prepare the patient mentally for the further treatment journey. So all these things are done by our care plan. Now, what is our care plan? That will also come in a few minutes. So generally after diagnosis, most of the time surgery is the first step, the treatment that is to be offered. Now after surgery, the promoting wound health or wound healing is the principal concern of the patient. So we try to address that with our care plan. And at the same time, the surgery generally follows with chemotherapy or radiation or immunotherapy type of treatments. So again, mental and physical preparation of the patient for this journey is also important. That also we offer in the patients of this phase. Then it comes the actual treatments like chemotherapy, radiation. Now we all know that there are some adverse effects, untoward effects. Some of them are expected at the same time. So our care plan addresses all those treatment challenges like potential discomfort, mental as well as physical. Both the types of discomforts are there. So during that treatment, our supplements help a lot, as we have seen already in our case study. Or also protect the healthy cells of the body. In our example that we had seen, the hostages are there, they are innocent. So they need to be saved from the battle of the terrorists and the commandos. So that work is also done by our care plan in this particular phase. Now, once the treatments are finished and there is no evidence of disease, cancer has completely regressed from the body, but still there is always a risk of recurrence. So it can come back anytime. So to take care of that, our immunity should be very excellent condition. So our care plan helps to improve the immunity so that we try to minimize the chances of recurrence at such cases. Also, there can be some effects of the previous treatment, some weakness, some symptoms can be there. So we take care of that also and focus towards improving the quality of life. Sometimes what happens, unfortunately, even after all the conventional treatments, the cancer tumor is resistant and it doesn't respond and it remains progressive. In this condition, again, chemotherapy, radiation might be needed to the patient. And at this phase, working on immunity is very much important. So our care plan offers some immunomodulatory modalities so that immunity is very good, and again the effect of treatments is enhanced. Again, handle physical and psychological discomfort. This is much more than at the time of newly diagnosed, because now here, even after the treatments, the disease is not responding. It brings a more anxiety and depression. So we need again a specialized care plan for that. Palliative phase is when the disease has progressed so that it cannot be cured or even or covered or even reverted. So only taking care of the symptoms and offer ease of life to the patient in this particular phase is very much important. And there are many severe symptoms which are very much troublesome for the patient, like lot of pain anywhere in the body, severe constipation, loose motion, loss of appetite, severe weakness. So we try to address all these things with our care plan in this particular phase. Now, seventh is a preventive phase, like prevention is very much important. Now, what happens? Each and every human being on this earth is susceptible to cancer in more or less fashion. But some people are more susceptible because of many reasons. There can be some genetic predisposition, or there can be some risk factor, exposure to risk factor, which can be voluntary like smoking, or which can be involuntary like living in a polluted place or so. So all these can be there. And again, our care plan takes information of about all this. And then we try to offer again some supplements, yoga, diet and lifestyle, just to improve the immunity and reduce the chances of Not of course to the 100%, but definitely we try to reduce the chances of occurrence of this disease. So these are the 7 phases, different phases. So the even though the disease is the same, but the understanding is different and our care plans are totally different. Now we are talking about all this care plan, but what is it? It is based on Ayurveda and yoga. This we have already mentioned. Now, what is Ayurveda? Again, it's again a science which has its own way of looking towards the body and the disease. Now we understand it like three dosha. These are like three bioenergies which will govern all our bodily functions, physiology and pathology. So if they are in equilibrium, they will work with means physiologically, then you are healthy. And if they get disturbed, then their imbalance will lead to any disease. The cancer is also one of them. Now, particularly in this disease, what we generally see is there is a abnormal cell division, which is attributed to aggravated Vata dosha. At the same time, there is bleeding and necrosis, which is generally seen, which is attributable to Pitta dosha as per Ayurveda. And there is a tumor formation, which is attributed to vitiated Kapha dosha. So all these three bioenergies are vitiated in some way or the other. And we understand it in our language and try to uh, rebuild their equilibrium. So why this equilibrium was lost? There can be some particular reason in each and every individual, and that reason can be different. So we understand this as a root cause, and identifying this root cause is very much important to have effective management and sometimes prevention strategies also. So we have a questionnaire and accordingly we go through all the information and then the care plan comes. Now, this Rasayana is a wonder drug category of Ayurveda. In some simple terms, they are like tonic sort of drugs or herbs. What they do, they will slow down the aging process, they will enhance immunity, intelligence, memory. So, everywhere positive impact they will show. They will nourish all the tissues, they will prevent degeneration and illnesses, and they are also having radioprotective and chemoprotective effect. That is also researches have been done and published in journals. So, these are the herbs for overall healing and reducing the side effects. Some of the very famous Rasayana category drugs are like Guduchi or Indian Tynospora. Then turmeric or amla is Indian gooseberry is another common name for that. So there are many. These are three only for examples. Now exactly these herbs and few other which are from this category, our health supplements are prepared from. Now, our important goal is like effective fusion of tradition and technology to offer maximum efficacy in minimal dosages. So, the herbs and all the wisdom comes from ancient Ayurveda, and the preparation of the formulations is as per the modern technology. So, it's a very good fusion or amalgamation of the ancient wisdom and the new technology. So what this offers to all our clients is they are high quality critical extracts, because of which also we are using advanced drug delivery systems like lyophilization. The effect of these two is better efficacy in lower dosages. So when dose is lower, automatically palatability increases. And most of the times, all the formulations are vegan friendly, can be safely taken by vegan people also. There are very few which contain cow milk or cow ghee, but they are not offered to the vegan. We have different options for them as well. So in every manner, they are very safe and very good supplements as such. Only diet or only supplements or formulations are not sufficient. There is always a support of diet and lifestyle, which is equally important. So dietary modifications, which is essential for meeting nutritional demands, and still it should be easy for digestion, because in this disease digestive fire is the first which is affected. So its power is less, so it should be tolerating that food, but still it should be nutritious is the important need of the any patient. So accordingly, we have dietary plans which are including veg or meat or even vegan friendly diets. And there are some simple diet or lifestyle modifications which we have talked. There can be some simple irregularities in the lifestyle. We try to correct that. This is very much important in every disease. but especially in cancer, diet and lifestyle modification is extremely important. So we have planned one another session, special session for diet and lifestyle modifications in a coming week by our diet team, which is specialized in the diet. So please try to attend that session as well. Now, yoga therapy, yoga itself is called as a equilibrium of mind, body, and soul. We call it as Yoga Chitta Vrittir Nirodha as well. So, controlling and conditioning your mind is the first and the foremost goal of yoga. So, what happens is yoga therapy shifts disease by addressing imbalances in mind, body, and soul, as we have mentioned, all the three equilibrium. Now, what is yoga? Many of us know about yoga, but generally it is asana, pranayama, and meditation practices to clean and rejuvenate the entire system. And that will detoxify all the body, and automatically the body can be set towards the path of health. So, these all three together make our care plan. These yoga modules will include mostly asana, which are different poses of the body, and then pranayama, which is a controlled breathing practices, and meditation practices as well. So they again they will differ as the needs of the patient will differ. No two patients may get same type of yoga. Some difference will be there because Ayurveda and yoga both believe in tailor-made system. Every individual is different and their needs are different. So our plans are also different. So after all this introduction about what we can do for cancer, we can have a quick look about exactly what this disease is. This is a totally different and very peculiar disease, and no other disease on this earth is similar with cancer. Most of us know that this is uncontrolled growth of abnormal cells which go beyond their boundaries, and they can even travel from one organ to another and have a seat in different organs as well. So this doesn't happen with any of the other diseases mostly. So there are few terms which we should know about this cancer when we want to fight with it, because good knowledge of the disease is very much important for fighting with it. So first of all, is a carcinogen. Carcinogen is any substance or any habit which will induce some change in the cell structure, especially the DNA structure of the cell, which we call as a mutation. It happens in the gene which are inside the DNA. So these genes are like a programs of our all our cellular function or body function. So if there is some change in that, so their normal function is lost, and that important normal function is apoptosis. What is apoptosis? That any normal cell, once its function is finished or the lifespan is finished, it will kill itself. So it is called as a programmed cell death or cell suicide as well. But because of this mutation, this cancer cell lose this apoptosis and they don't die. They become immortal and they need to be killed with all those commandos like surgery, chemotherapy, radiation, and so on. Another problem which happens with mutation is dysplasia. In our body, all the cells are dividing continuously and they are producing new cells. And the new cells are exactly identical with the previous. The previous cell we call as a mother cell, and the new cell we call as a daughter cell. So they are equal, exactly identical in physiology. But because of this mutation, the new cells which are forming are totally different from their mother cell, and they grow very fast and they don't die as well. So as a effect of both of them, what happens is formation of a tumor, or we also call it as a SOL. You might have come across this term many times. It's a space occupying lesion. So any new growth or tumor or neoplasm, all three are the same or synonyms. And metastasis again is a hallmark of cancer. We already talked about it. The cells can travel from one organ to another, and they can find seat in different organs, and that is called as a metastasis. So this all this information comes from the official website of WHO. Now, especially in USA or all over the world actually, but in USA also, this problem is very big. Now in 2022, it was estimated that around 2 million new cancer cases every year and around 600,000 deaths. So that comes to around 400 new cases per million and around 144 people dying in 1 million in 1 year. So this is the second highest cause of death in the US just after the heart diseases. And in 5 deaths in the US, one is due to some of the cancer, this either lung or breast. Now this is a division of new cases and the deaths. Now if you add these two numbers, it will come to around 1.9 million. So this is the addition, and male, female, organ wise, all the details can be seen. And the deaths again, if you add this and this, it will come to 600,000. So this is the bifurcation gender wise and organ wise because of cancer. This is not only a disease, but at the same time, it's a socio-emotional burden. Whenever there is a diagnosis of cancer, then obviously there is a lot of depression and the patient feels very much isolated from the society, which is but natural. It is really painful. Sometimes there is a depression or anxiety. The patient will start thinking like, why me? Why I was caught with this disease? What wrong I have done to the people? Something like that. Or sometimes or many times there is a resistance to accept the diagnosis. They will think that this is not my diagnosis, but wrongly the diagnosis came under my name or whatnot. For some time span, this is all normal, but there should be time that we need to come out of that and start to fight with the disease. And being able to accept the condition is the first and foremost step of efforts to overcome it. So accepting as early as possible is a first step towards the victory over this disease. This is not only socio-emotional but financial burden as well. There, we all know that the treatments are very much costly and long-lasting also, not 15 days, 20 days, it may not be the case, 4 months, 6 months, 1 year. And again, repeatedly investigations also have to be done. They are also costly, but some cases or many places these expenses can be reimbursed. So these direct expenses can be reimbursed through insurances and many things. But there are indirect expenses as well, because the patient may not be able to go to the work, so the income is hampered. Again, for treatments or investigations, patient cannot go alone, so somebody has to accompany. Again, that person has to uh, sacrifice his income for that day. So there is indirect burden as well. So it is estimated that around $21 billion is a total financial burden over the economy, of which 16 billion is a direct burden and 5 billion per year is an indirect financial burden. So it's really very huge. So to fight with all these things, our individual health we need to keep as good as possible as a prevention or even after getting the disease. So our LYBL healthcare program integrates this whole approach. I'm repeating this again, and it is inspired by Ayurveda and yoga. So what we offer from our perspective is restoration of doshas, which are the physical bioenergies like Vata, Pitta and Kapha. Then restoration of the Trigunas, which are the mental controllers like Sattva, Raja and Tama. Their balance is equally important for mental well-being. Then we try to minimize the adverse effects of chemo and radiation therapy. Agni is very much important, which is the digestive fire or digestive capacity of the person. If digestion is very good, it is very much able to nullify many ill things in our body. So its health is very much important as far as Ayurveda understanding is concerned. When we try to reduce burden by trying to reduce the inflammation which is around the tumor, then minimize the chances of recurrence. This we already discussed by enhancing the immunity and try to minimize the pain and other symptoms, especially in progressive and palliation phase with our care plan. So what are the take home points? It is very much important to focus on overall healing. Only killing the cancer tumor cells is not sufficient, but there is a lot of other things. Those are also to be done for overall good health. Addressing the root cause is very much important. Some root causes we know, like smoking, alcohol, and some exposures. But in every individual, as per Ayurveda understanding, there is some root cause, and we need to address that, and we need to nullify that as well. Proven herbal supplements. In our supplements, the knowledge, initial knowledge comes from Ayurveda, but again, it is proven by different clinical trials or researches. Then diet lifestyle modifications, we have a special team for that, who will address the diet and lifestyle concerns of the person, and tailored recommendations will be provided. Then yoga, obviously, it's a disease of mind and body. So health of mind is equally important as health of the body. So yoga will help for the mental strength. So to avail all these benefits, what you need to do is simply download the LYBL app and join the cancer community in that. So these are the references from which all this information was taken and shared with you. So with this, I would thank you all for joining this webinar. And if you have any questions, you can put it into chat, or then Dr. Bhaswati can coordinate the session. So thank you so much once again, and over to you, Bhaswati ji.
Great. So there was a question by Eleni, what does LYBL stand for? And Dr. Lula explained that we are Live Your Best Life. You'll see it in the upper right-hand side. The logo is there very clearly, Eleni. And it's the name of the company, the startup that we are all working